The 2015 legislative session begins January 21st, and Hawaii's elected officials are gearing up.
Good evening, aloha.
Recently, North Hawaii's State Representative Cindy Evans updated the Waimea Community Association on the changing political landscape in Honolulu, now that the state has a new governor at the helm.
I'm anxious because the session starts on January 21st, and I can't wait to hear what Ige tells us in his State of the Address and tells us what he sees as priorities. But he's saying, at least during his campaign and when he first came out and got interviewed, he claimed that education was really, really big for him. And he wanted to empower all the schools at the local level to educate the kids. What is that going to look like? I don't know. The other thing is he's a little concerned about the fiscal issue because he was the Senate Chair of Ways and Means. And what he understands is we are having a problem with unfunded liability, that we have so many people retiring and so many people that were government employees retired that are living to be in their 90s, some over 100. And we have obligations that we have to meet with them. And because that population is growing, that means we have to pay for their benefits, retirement as well as health care. And so this liability is growing, and we have to figure a way how to fund it. That cuts in to the programs and services we want at our local level. So he's trying to figure out how to meet these and at the same time to bring programs and services. So I think he's going to be conservative this year. That's my bet, is he's going to be real conservative because he sees there's some things that he has to get a handle on. Hawaii Health Systems Corporation met with Kona Community Hospital and Hilo Community Hospital over the last 2 days. They're going to the legislature. I think they're going to be asking for anywhere from $120 to $220 million. Why? Because the new contracts for the employees, they get pay raises and they get more benefits coming up. And that means we have to pay it. And they don't have the money. They claim they don't have the money. So each hospital in the last couple of years has been doing operational changes. They've been trying to find efficiencies. They've been trying to cut their cost of service or cost of doing business, but they don't want to cut our health care programs and service and delivery. So what they're saying is, because you've increased the wages and the benefits for employees, you need to come up with the money, legislature, and help us out. So I think it's going to be a huge ask. With the unfunded liability, with this new help of Hawaii Health Systems Corporation, we know that we're going to start the legislature already with this big nut, right, that we got to face. So I think he's telling people that this year he's got to look at how to be fiscally prudent. The governor came in and he had Neil Abercrombie's budget drafted, ready to submit to the legislature. What we understand is that Governor Abercrombie had told his directors to not add any new programs or services, kind of approach it from a status quo viewpoint, maybe some housekeeping measures that wanted to be introduced or taken care of, but not really look at any forward thinking. And so when he got elected and he came, he had only 30 days to figure out what he wanted to do. So what he's told the legislature is that what you're seeing is really Abercrombie's recommendation for the budget, but bear with me because over the next 30 days, I will continue to talk to you, possibly send you letters from the governor's office telling you what I'm seeing as some priorities after talking to my new directors, which is the other dynamic that's going on right now, and that is he had to appoint his new cabinet.
Evans spoke candidly about her observations behind the scenes.
It was interesting. I had a few minutes with the governor, and his question to me was, why is it when I traveled during the campaign, the people that told me about their concerns of government and they spoke the loudest about not getting their needs met came from the Big Island? And he said, why? He said, the loudest and the most complaints were from the Big Island. And he goes, why? What do you think that is? And my answer was, I don't believe the people at the departments were listening. They weren't hearing what the people were saying from the Big Island. Now, part of that is because it is Oahu-centric. I mean, it is where the population base is. It is where the directors were having their offices, and the directors were not as far, they weren't doing their community outreach as much as what this governor wants. They were in Honolulu doing the day-to-day operations, doing more of the hands-on administrative work. They had not delegated it down. And so they were really in the trenches doing more. So they had to stay in Honolulu. So what was happening is, I believe they were starting to get a little more disconnected. In Oahu, they were working on priorities, but they weren't hearing as well as they should have what was going on in rural Hawaii.